Thank you, Andy, and thank you for the media for joining us once again. We have a lot to cover today, so I'll just go ahead and get started. As typical, we will start with some numbers. As of this morning, Northern Light Health is taking care of 4 individuals who are positive for COVID-19 throughout our health system. 2 of those are in Acadia Hospital, 2 are at A.R. Gould Hospital, 18 at Eastern Maine Medical Center, 5 at Inland Hospital, 6 at Maine Coast Hospital, 2 at Mayo Hospital, 4 at Mercy Hospital, and 2 at Sebasticook Valley Hospital. In addition, our home care and hospice team is taking care of 8 individuals who are positive for COVID-19 within their homes. Our 2-week positivity rate is now 10.84%, and our 1-week positivity rate is 11.54%. So we continue to see a significant community spread across our state, and that is concerning. We continue to share our COVID-19 hospitalization graphic with the public that details the number of people hospitalized with COVID-19 who are vaccinated and unvaccinated. The numbers continue to show that those who are vaccinated have lower cases of hospitalization and severe illness. As we noted before, this graphic represents a snapshot in time, and the data is changing constantly. Today's graphic will be shared in the chat and also available on our Facebook page. Now the exciting news. Yesterday, the FDA and the CDC authorized Pfizer COVID-19 vaccinations for children ages 5 through 11. At Northern Light Health, we believe that vaccination is the best step in preventing the risk of serious illness and death from COVID-19, as well as reducing the risk of spreading the disease. Over the next few days, we will be preparing to vaccinate patients between the ages of 5 and 11 and anticipate that appointments will open up in our online scheduling tool for these ages on Monday, November 8th, once we have confirmed how much vaccine we will receive. While COVID-19 infection is less risky for children, children can become seriously ill, require hospitalization, and even die from COVID-19. They can also spread COVID-19 to vulnerable people in their family and communities. Getting vaccinated protects children and the people around them. Some children with mild symptoms of COVID-19 have had longer health issues known as long COVID syndrome or post-acute COVID syndrome. Vaccination also means it is less likely that your children will miss school from COVID-19 illness or exposure. The ways that we can facilitate getting your children vaccinated: for community members between ages 5 and 11, there are many options to get vaccinated. Vaccines will be offered at Northern Light Health pediatric and primary care offices. While many practices do not offer COVID-19 vaccine-specific appointments outside of the registration tool, patients can be vaccinated during any checkup, wellness, or other scheduled care appointment with their care team. This is subject to vaccine available at the time of the visit. Northern Light Health COVID-19 vaccination clinics will be set up where guardians can register their children 5 to 11 using our online registration tool. Phone registration is available on a limited basis at 207-204-8551. I will caution that long-distance charges may apply. In regions where demand outpaces appointments, there may be COVID-19 vaccination efforts offered on specific days and times for those ages 5 through 11. This information will be shared locally. These may include school or other community-based clinics. Retail pharmacies may also offer vaccine. Just like the adult and teen community members, kids 5 to 11 will be able to get vaccinated at many retail pharmacies. You may want to check with your local pharmacy prior to arriving for the vaccine. We know that many people are excited to protect more of their family members from COVID-19. We also know that many of you have questions, and we want to help answer them. Here are answers for some of the more commonly asked questions. The vaccine authorized for ages 5 to 11 is the same vaccine used for those 12 and over, but it is a smaller dose. The vaccine is specifically made to meet this dosage and supplied in a multi-dose vial. Like for those over 12, this is a 2-shot series administered at least 3 weeks apart. The vaccine's safety was studied in approximately 3,100 children ages 5 through 11 who received the vaccine, and no serious side effects have been detected in this ongoing study. In the study, the vaccine side effects for those 5 to 11 were mild to moderate and were similar to those people over age 12, with injection site pain or a sore arm, redness and swelling, fatigue, headache, muscle and joint pain, chills, fevers, swollen lymph nodes, nausea, and decreased appetite. These were all self-limited. At this time, only the Pfizer BioNTech COVID-19 vaccine has been authorized for people ages 5 to 11. The immune response for children 5 to 11 years of age were comparable to those for individuals 16 through 25 years of age. In addition, the vaccine was found to be 90.7% effective in preventing COVID-19 in children between the ages of 5 and 11. If you have questions specific to your child's health, COVID-19, and the COVID-19 vaccine, please reach out to your care team. Let me close by saying we are excited to offer vaccinations to more of our community members. And with that, I'll turn it over to Paul.
Great, thanks, Dr. Jarvis. So just to recap in terms of employment and vaccination status, Friday of last week at midnight marked the deadline for all employees in healthcare in the state of Maine to be fully vaccinated or have an approved medical exemption against COVID-19 and against the medical exemption against the COVID-19 vaccination. And at that time, we had 233 employees who were not compliant with the state and were removed from our schedule. That comprised 1.89% of our workforce. So that means 98.11% of our staff were vaccinated by the state definition by the deadline. Since that time, that 232, a small number have changed their mind and received vaccine. Another group have opted to not participate in our 7-day reconsideration period that we've offered to employees that will allow them a 7-day grace period, if you will, where they're not working, they're not engaged in any working activities, but they are home and have the opportunity to change their mind, to start the vaccination process and work with us to become fully vaccinated before they are reintroduced to the workforce. And so that time frame continues. At this point, we have 191 people in the 7-day reconsideration period, and we're happy to respond to questions that they may have along the way. But our focus continues to be, even in these hours after the deadline, responding to questions that employees have, being respectful of whatever their decision is and supporting them in their decision. And in addition, prior to the deadline, we have a total now of 195 people who have left our employment since the vaccine mandate was announced back this summer. And that concludes my update for that. We'll open up to questions unless Dr. Jarvis has any additional comments.
No, thank you, Paul. I think it's Andy, back to you.
All right, we'll start with Brittany, you should be able to unmute now.
Okay, thank you very much. Dr. Jarvis, I'll start with a question for you. Did you say, first of all, that it was going to be November 8th that children 5 to 11 were going to be able to begin receiving vaccines? And I know there's still a lot of questions that you don't even have the answers to yet, but do you have any idea about, how many that you will be getting of these doses specific to the 5 to 11 age group? Any indication yet what that breakdown is going to be?
So I'll answer the second part first. So we don't have an indication yet as to how much vaccine. I checked early this morning, and as of late yesterday, we had not received our allotment yet for Northern Light Health. I expect that to happen today. We were told it would happen sometime between Monday and today. And so at that point, we'll know a little bit better. What we have done is started our process for starting our online vaccination process, which should go online on Monday, where people will be able to go ahead and schedule their appointments as long as we don't have any issues before then. So on Monday, we should allow people to go ahead and schedule. Some people may be able to get their vaccine a little bit sooner depending on how a particular office is set up, but it will take us a little bit of time for us to coordinate all of those, and really it will come down to what vaccine comes and how we're able to distribute that across the state.
I'm sorry, so just a quick follow-up on that. So the scheduling will be starting on Monday and no definite date yet of when the vaccines will start to be given out, right?
Correct. We hope to be able to do it shortly after putting our online schedule. What we want to do is ensure that when people make an appointment that we have vaccine available for them. So no different than when we had vaccine efforts before. Once we get to a point, and hopefully we get to a point where we have a sufficient quantity, we can be a little less restrictive in that regard. At the same time, as soon as we're able to administer or deliver vaccine to each of our practices, then, as I said, children who are seen for a regular routine office visit, as long as there's vaccine available, should be able to get vaccinated at that time as well.
All right, thank you, Brittany. Next is New Center, Maine. Chris, you should be able to unmute.
Hi there. My question is for Dr. Jarvis. Dr. Jarvis, my first question has two parts. So if you don't mind, I'll just kind of spell them out here a little bit. I know that when we had opened up the vaccines widely to those 18 plus, there was lots of interest. It caused some delays on many hospital systems, scheduling platforms. One, are you expecting a lot of interest, and how will you handle that? And I guess the second part is sort of on the flip side. How is the hospital system going to address vaccine hesitancy in parents about getting the shot for their kids?
We don't expect that there should be traffic issues with our online scheduling system. If you recall, the last time that we opened it up, we were able to handle the traffic very well, and we expect that. Again, this is going to be a smaller population than any other population we had previously opened up at one single time. Again, anything with technology, there may be issues, and we will work on those as we need to and address them in a timely fashion. As far as vaccine hesitancy goes, we will continue the same way that we have gone through this entire pandemic and through our vaccination process, and that is to educate the public with the information that we know at the time. And so we will continue to do that with parents. We will have outreach through our practices. Our providers have already been given the information about this particular vaccine and its usage and its safety profile as well. And then, of course, we've been relying on the media, and so we will continue to hold events like this as necessary in order to continue to educate the public.
Thank you. And my second question, if you don't mind, just kind of taking a look back, we are at about 19 or 20 months into this pandemic. And when you look at the milestone that we have, achieved, not only in our vaccination rates of 80% of the current eligible population having a final dose in our state, but also now this promise for kids ages 5 to 11 to also potentially get that protection if they or their parents would like them to. How does that feel? What do you think about when you look at this moment in time, given what we've been through and all you've seen on the front lines of this pandemic?
Yeah, so it's exciting news. We've talked frequently about children and COVID-19, and we know that we have seen discussions about that play out in our school board meetings, across the media, and even in politics. But the fact of the matter is, children shouldn't be sick, and children shouldn't die from diseases we can prevent. And so this offers us the opportunity to protect our children and to protect those that surround them. Too many children have been orphaned during this pandemic. And we don't want to see that happen anymore. And certainly we want to make sure that kids are back in school and doing the things that are necessary for them. So I'm elated and excited by this next milestone and the fact that we'll be able to protect even a younger population. And the more that we get vaccinated, and we know the lower the amount of viruses out in our communities, the more that we can get back to a sense of normalcy. And so I'm hopeful for the prospects in the future. I just, anyone who has any concerns about vaccine, please reach out to a reliable source and get correct information.
All right, thank you, Chris, for your question. Next up, we have Joe Lawler, Portland Press Herald. Joe, you should be able to unmute now.
Hi, thanks. This question is for Dr. Jarvis. I guess I'm just curious what you think about what this age group being vaccinated means for the ability to further tamp down cases. We've had a lot of cases and hospitalizations lately. Do you think this will make a significant difference in being able to curb that?
Yeah, so again, thankfully, children have not been severely affected in a large part by COVID-19 directly. But obviously, it's, again, like I said, the people that surround them that have unfortunately suffered from this disease. And we do know that children who are infected with COVID-19 do spread the virus to people in their household and people in the community. And we've seen schools that have had to put significant number of children on quarantine or close down altogether, and we don't want any of that to happen. And so the hope is that, yes, indeed, as we begin to vaccinate more. We also know that nationally and here in Maine that a larger number of those who are becoming infected are younger individuals, including people under the age of 12. And so, again, this gives them an added layer of protection that they didn't have before, and so should help us to again, curb this spread. But really, it's a community effort. We all need to be vaccinated if we're eligible and it's safe to do so, because because when we're looking at that bigger picture, that global picture, the more of us who are vaccinated, the less virus in our communities, the less spread, the less people who will wind up being hospitalized, and the less death. And we can see those numbers here in the state of Maine, where our mortality rate is lower than many other states because our vaccination rate has been so high, and we want to continue that process. Unfortunately, our case counts continue to be high, but thankfully less hospitalizations, but still we are at a critical juncture, and hopefully this will help improve that.
I just had one question today. Thanks a lot.
Thank you.
Thank you.
All right, thanks, Joe. Next up, we have Maine Public. Carol. Should be able to unmute now, Carol.
Hi, thank you. This
Thank
is
you.
for Dr. Jarvis or your colleague. I'm wondering, given the loss of a staff at your facilities, have you had to suspend any procedures?
So in no global fashion have we had to curtail services, and Northern Light Health has been very fortunate in that regard. We continue to monitor our situation, and oftentimes due to capacity issues, we have had to have isolated incidents where we may need to postpone a non-urgent procedure for a particular period of time. We continue to evaluate that on an ongoing basis, and in fact, our OR teams review their cases on a daily basis to ensure that they are providing adequate and appropriate services, but at the same time keeping mindful of the fact that we need to have some capacity in order to take care of those emergent conditions such as motor vehicle accidents, heart attacks, and the like. And so it is a balancing act that we continue to have. There is no surprise here that we suffer with capacity issues like the rest of the state of Maine, but thankfully we've been able to manage things to a point where we have not had to curtail any particular service, and certainly nothing for any prolonged period of time. So thank you for that question.
Nope, thank you, Dr. Jarvis, I appreciate that. Are you vaccinating employees' children or anybody on the premises, or you basically said you don't have the vaccine yet to be able to proceed?
Correct. We have not started any vaccination efforts for people under the age of 12 as of yet. We hope to do that shortly, and hopefully by early next week.
Thank you.
You're welcome.
All right, thanks, Carol. Next up, we have WGME. Mal, you should be able to unmute now.
Okay, thank you. My questions are mostly, I understand that you're going to be vaccinating some kids through, their doctor's offices and things like that, but I'm more focused on the rollout at schools and school districts. How many districts have already expressed a desire to have a school-based clinic, and how long might that take to get through that list?
So Mal, that's an excellent question. I will say that just about every other phase of this pandemic, we have worked collaboratively as a state, and that's wonderful news. And so for many months now, we have been working with the Department of Education, our school nurses, and our partners around the state to prepare for the ability to give vaccines to those under the age of 12, much like we did back in the spring for those ages 12 to 18. So we have a number of school districts who have already set up their times. They were obviously tentative times until the good news that we received last night. And so those will all be firmed up. We expect then that communication will come out from those schools that are going to be able to offer school-based clinics. Remember, we have been doing school-based vaccinations and wellness care for a very long time in the state of Maine. We traditionally have been able to vaccinate many individuals against influenza during school-based vaccination sites, and this really should be no different from that, and really should be that discussion about protecting the health and well-being of our children and the people that our children come in contact with. And so I am very hopeful that we will see that at least that every school district provides some opportunity. We know that there are those who are challenged to get into a doctor's office or a pharmacy and the like to get needed preventative care like protection against COVID-19, and school-based clinics certainly offer us the opportunity to do that. As I said, this is a collaborative effort between many agencies across the state. And so down in the southern part of the state, Northern Light Health's home care and hospice team has already started working with some school districts. Here in the greater Bangor area, Penobscot Community Health Centers does the same. And then in our more rural locations, it is just matching up to make sure that we have reached out to schools. If you are in a school district where currently they do not have plans to do a vaccination clinic and you as a parent are concerned about that, please reach out to your school district and say, hey, listen, this is an opportunity for my child to get protected and I want that opportunity, and have them reach out to Northern Light Health. We'll be happy to assist with setting up a program, whether that be through a Northern Light Health entity or any of our partners across the state. So thank you for the opportunity to put that very important message out there.
Yeah, I'm also interested to hear how the staffing will work for that, at least at the school-based clinics. Have you firmed up plans if those will be Northern Light employees, nurses, doctors helping to administer the shot, or will it be left up to the school districts to staff those clinics?
So we've always relied on schools to help provide at least some support to when we do school-based vaccination clinics, whether that be for COVID-19 or influenza or for other preventable diseases. So we've relied on them staffing to make sure that we have the right child in the right place at the right time, that the paperwork is completed. But it will be healthcare professionals who will be administering vaccinations like we have in the past. We utilize our school nurses and obviously Northern Light Health at those clinics that we will be facilitating. It will be our staff as well. Our home care and hospice team at some points vaccinate more people against influenza than any other single entity in the state. We're proud of the fact that we've been able to do that year in and year out, and we're proud of the fact that we're going to be able to do that for this particular pandemic and prevent this disease in children.
All right, thanks, Mal, for your questions. Next we'll go to Bangor Daily News. David, you should be able to unmute now.
Great, thanks. These questions are both for Dr. Jarvis. A nationwide Kaiser Family Foundation poll conducted from October 14th to the 24th found that about 27% of parents said they would get their 5 to 11-year-old child vaccinated immediately. Another 1/3 said they're going to wait and see, and about 30% said they would never do it. Do you think that number is higher or lower around the Penobscot County area? Do you have any sense of that so far? I know it's very new. But what have you heard from residents so far about this? Do you have a sense of how they're feeling?
I can say that I had a lot of people reach out to me yesterday, and I know as of other members of the Northern Light family, to say thank goodness, because I really want my child. It's the last member of my family who I need to add this added layer of protection for. And so we know that there is going to be, as we've seen in every phase of our vaccination process, those who initially are very much dedicated to getting that vaccine in as soon as possible. We also know that there are those who still have questions and want those questions answered, and oftentimes that will require them to speak with one of their healthcare providers, and so we encourage people to do that. And we will continue to do this for a period of time. Again, Northern Light Health's promise since the beginning of our vaccination process is that we will continue to vaccinate until every Mainer who is eligible and wants to be vaccinated is vaccinated. And so we have no delusions that by the end of November we have vaccinated all the children, but we do hope that we have vaccinated as many as possible, again mostly being dependent on what supplies we get in terms of vaccination supply, and then we will continue that process much like we do with influenza. While I encourage everyone to go out and get their flu shot today, we know that there will be those who will delay, and we will still be giving out flu shots at the end of winter, beginning of spring. I feel that we'll probably have to do the same thing with the COVID-19 vaccination. But please, if you right now are ready to get vaccinated, as soon as they become available, please sign your children up.
And my second question is, Lifelight of Maine told us recently that they're still transporting quite a few COVID-19 patients throughout Maine. There are, just really a lot of just serious infections at Maine's hospitals. How would you describe the state of life-threatening COVID-19 hospitalizations in Maine? Are there any indications the numbers are rising and falling? Just a quick follow-up to what you said previously. Do you think people are seeing this different than the flu vaccine? And does that kind of confuse you still at this stage of the pandemic, the flu vaccine and other vaccines?
I've been in healthcare for a long time. I've been an educator for a long time, and I've dealt with public health for a long time. So nothing surprises me. I think we all get our information from particular sources, and sometimes that makes things a little bit confusing. Sometimes it makes things more concerning than I myself might feel. And that's why I've been in education, and that's why Northern Light Health is proud to educate on the state of where things are today based on facts and data that we know. And we know that again, children can be affected by COVID-19. Some of them can have severe illness and in fact die. And again, I'm going to say children are not supposed to die. And if there's things that we can do to prevent death, we should be doing that. This happens to be one of those methods that we have. In terms of continued severe disease. Our hospitalizations across the state of Maine have been flat for the last few weeks now. However, you see rises and falls. Sometimes it's in the Penobscot area that we see a rise, and sometimes it's in the Portland area. And of course, our small community hospitals across the state continue to do tremendous heroic work in taking care of individuals who are ill from COVID-19. But unfortunately, those who have severe illness need to go to a higher level of care. And we are strapped when it comes to the ability to perform higher level of care, not because of staffing issues that are acute, but for long-term systemic problems that we've had with healthcare across the state of Maine, that we simply do not have enough beds to care for all of the problems and healthcare conditions that we see. Adding to that is the fact that COVID-19 patients who require intensive care require more intensive care than the usual patient in a critical care setting, sometimes often needing to have 2 nurses care for them full-time all the time, which means that at least one of those nurses is then not available to take care of another person. All of those put together, including the problem that we have with not having enough long-term care or skilled nursing beds in our state, means that our hospitals are full. When our hospitals are full, unfortunately, that sometimes means care is not delivered as close to home as we would all like. We need to work to do things better. One of the ways as a giant community of our state that can do to help that is to limit the number of COVID-19 cases that we see. The single best way to do that is to be vaccinated. In addition, we should be wearing masks when we are indoors in a public place. We should be remaining appropriate socially distanced. We should wash our hands at all times. And very, very important, if you are ill, stay home unless you need health care, because that's where the spread has been that we have seen the most. Is people who feel, oh, well, it's just a cold, oh, it's just the flu, wind up spreading cold, flu, and COVID to our community members, some of whom are more vulnerable than others. They wind up in our hospitals, and unfortunately, that's leading to the problem that you've just described. So thank you again, and I apologize for my long-winded answer, but I think it's important that we set the facts straight and that we really talk about what's actually happening across our healthcare system. So thank you.
All right, thanks, David, for your question. Next, we have David, Fox 22, ABC 7. His mic is down, but he sent me a question to ask you, Dr. Jarvis. You've answered some of this already, but he's wondering when we'll expect to start vaccinating children 5 to 11. I think you touched on that. His other question is, how is the state preparing for this? So maybe you could comment on the state and maybe Northern Light, anything we're doing to prepare for that next week.
Yeah, so again, once again, one of the proudest, things that I can state about living here is how well Mainers have come together and how well companies that people would think are competitors have been so collaborative during this pandemic, and this is no different. So again, we have been working very closely to ensure that we can set up things like school-based clinics or community-based clinics to outreach to as many children as possible. At the same time, coordinating with pharmacies and other agencies to ensure that we have vaccine spread across the entire state. Most of this rollout will come out through the state, as many of us are contracted with the state to provide COVID-19 vaccinations. Retail pharmacies may have a separate avenue, and federally qualified health centers may have yet a third avenue. Those details still remain to be finalized, but we expect all of that to happen. And so it will be basically a rollout. Again, Northern Light Health expects that by today, we should have our allocation of vaccine for all of our health system, and that puts us perfectly in line to be able to start administering vaccine for people ages 5 to 11 next week.
All right, and last but not least, Ross, WMTW. You should be able to unmute now.
Hi, everyone. Thank you. My question is for Dr. Jarvis. I guess what would you say to a parent of a child who maybe is 11 years and like 9 months old, a child who's about to turn 12 years old and technically be eligible for the quote unquote full dose of vaccine, the one that's been given to the adult population so far. Maybe that parent is thinking, well, why don't I wait a couple weeks or a couple months or however long so they can get the other one rather than this one that is about a third the dose?
Yeah, so I think, again, that's a discussion that really has to happen between the caregivers and their care team. And so reaching out to your provider to kind of talk about those nuances. When we start talking about when things are given authorization, there has to be clear-cut numbers, and therefore that's the reason why it is an age. So 11 months and or 11 years and 11 months is still not to 12, and so that has to be that consideration then of do I wait or do I not? But we have seen is again the studies did have children who are all the way through most of their age 11, and even this lesser dose was proven to be effective in preventing disease, and so I think people can feel comfortable that they could get the lower dose vaccine, even if they're close to the age of 12, but not quite there to meet the requirements for the adult age, and still feel very comfortable that they have received a dose that provides an immune response adequate to prevent disease.
That's all I had. Thank you very much.
Thank you.
All right, so I think that's the end of our list, so we can point it in there for today. Thanks all, as always, for attending and helping us get out this important information. As I talked about at the beginning, we'll have that high-quality video file available in the bit. Just let us know in the chat or by email if you'd like to have that. We'll send it over to you as soon as it's ready. A reminder that COVID-19 inpatient graphic that Dr. Jarvis mentioned is in the chat. So you can grab it there, and if you aren't able to grab it before you go, just follow up with us and we can send it over to you. And I think that's it. Dr. Jarvis, final word?
Thank you all for attending. I'm sorry for Mr. Bolin that I hogged all of the time today, but we kind of expected that with the news yesterday. Again, thank you to the media for getting out our message. It's really important. You guys are part of our care team as well, and we thank you for doing all of that. Everybody stay safe.
Thank you.